My name is Jessica Stanley. I'm a regional overdose prevention specialist. I serve Knox County. I'm a certified peer recovery specialist and a certified young adult peer support specialist. Naloxone saved my life, so I really appreciate being able to do this for the state of Tennessee. Okay, so we're going to look at recognizing and responding to an overdose. And we're going to start off with what an overdose is. So an overdose is when an individual consumes a toxic amount of a substance or multiple substances, and this is going to overwhelm their body. We have 3 different types of overdoses. There are obviously illicit substances, things like heroin and fentanyl, and then we also have prescription medication overdoses. So these can be things like hydrocodone, Adderall, Ritalin, and then we also have over-the-counter medication overdoses, so things like Tylenol, Benadryl that people experience, but all of these overdose deaths are preventable with the right tools. So opioids is a term for medications and drugs that bind to opioid receptors in the brain. Opioids affect the brain's regulation of breathing. So an overdose occurs when too many opioids attach to too many of the brain receptors, and this is going to cause the breathing to stop. Opioid overdoses can be caused by prescription and or illegal opioids. A lot of the common prescription opioids that we see are things like codeine, morphine, oxycodone, and hydromorphone. Most of the opioid overdoses involve illicit substances, so things like heroin, fentanyl, nitazines, and also fake pills that look like prescription medications. So typically we see opioid overdoses happen slowly over the course of several hours, but we are seeing it more quickly when fentanyl is involved. We have different signs and symptoms of looking at opioid overdoses. So the signs that an opioid overdose may occur are going to be things like an individual having small pupils, they can be nodding out, their speech can be slurred, they can be scratching a lot, and also they may be out of it, but they can respond to outside stimulus. So that's going to be anything outside of their body if you're saying something to get their attention or you are gently shaking them. And then also we have signs of what an actual opioid overdose looks like. So this is going to be an individual being unresponsive to that stimulus. Their breathing can be very slow and shallow, erratic, or stopped. Their pulse also can be slow, erratic, or undetectable. They can be making choking sounds or gurgling noises. They can be vomiting, their body can be limp, and their face and their skin can turn different colors. Depending on what substance in the individual, it can turn lighter or darker. Stimulants are a type of substance that speed up the messages traveling between the brain and body, elevating mood and increasing feelings of well-being, energy, and alertness. Stimulant overdoses have physical and psychological effects. So these physical events are going to be things like heart attacks, strokes, and seizures. And then the mental health events are going to be things like extreme panic, paranoia, hallucinations, and or psychosis. Stimulant overdoses can be caused by prescription and or illegal stimulants. So the common prescription stimulants are going to be things like Adderall and Ritalin. And then we also have the illicit substances such as cocaine, crack cocaine, and methamphetamines. So stimulant overdoses can result in both physical and psychological symptoms. The physical symptoms are going to be things like an individual being nauseous, they can be passing out, experiencing chest pain or convulsions, their breathing can be irregular, they can experience limb jerking or rigidity, they can have tremors, feel paralyzed while they're awake, unable to sleep, rapidly increasing temperature, and also fever, and then also their pupils can be large. And then the psychological symptoms, again, these are going to be the mental health events, so things like extreme anxiety, panic, paranoia, hallucinations. They can be agitated or irritable, and then also have hyper-awareness of their surroundings. So in Tennessee, overdoses that involve multiple substances are really common. The signs and symptoms of these overdoses can look different from what was previously described. Roughly 2 out of 5 of our overdose deaths in 2021 did involve an opioid and a stimulant. And so these combination of different kinds of substances increase the risk of an overdose for an individual. So if you think that an opioid or fentanyl could be involved, we want to make sure that we administer naloxone. So when we're responding to an overdose, we always want to assess these situations. First, we want to know if this person is responsive and can they communicate with you. And then also we want to assess your personal safety. So we want to know if you feel safe approaching this person without endangering yourself. So if this person is responsive and they can communicate with you, at this point, this would mean that basically you are just there as a support system for this individual. And if for any reason that person were to go unconscious in front of you, that is when you are able to morally make a decision on how you should act on this situation. But with that being said, we always want to make sure that your safety is the most important thing in this situation. If for any reason you feel like this is dangerous or it is something that does not make you comfortable to respond to, please make sure that you call 911. So administering naloxone is the most common and effective way to reverse an opioid overdose. What happens is naloxone binds to these receptors more powerfully than the opioid, so it's initially going to pull them off of the sites and attach itself. This is going to open up the airway for the individual to breathe temporarily for about 30 to 90 minutes. Naloxone is going to result into someone going into temporary withdrawals after they have been administered it, and it is not possible to overdose someone on naloxone. So if you feel like they are not as responsive as they should be, you can administer another dose. And naloxone is going to restore the breathing. So any other symptoms that are caused by stimulants or tranquilizers will not be affected by naloxone, and these need to be treated by medical professionals. So we always want to make sure that we're calling 911 as soon as we suspect an overdose. The type of naloxone that we distribute, we have the 4 milligram Narcan nasal device, and then we also have the Cloxato, which is double strength, and it is 8 milligram nasal device. We want to make sure that we are storing these properly. They always need to be kept in the pack unless they're ready to use. We want to make sure that we keep them at room temperature, so this is going to be about 68 to 77 degrees. We really want to avoid any extreme temperatures and protect these from light as much as possible. It's really important to monitor the expiration date that are on these. They normally have about a 24 to 36 month turnaround. Okay, so when we're responding to an overdose, the first thing that we want to do is try to maintain their responsiveness. This is when we're going to start with the outside stimulus. We want to try to say something to get this individual's attention and try to gently shake them. If they're not responding to that, this is when we're going to utilize the sternum rub. So with the sternum rub, you're going to make a fist and use your middle joints and press and rub on the middle of their chest as hard as you can. If an individual does not respond to that sternum rub, at this point, this is when we're going to administer the naloxone. So we call this peel, place, and press. All we're going to do is peel the back off of the package. We're going to place the device inside their nostril, and then we're going to press the release button. We want to make sure that we do not prime this device. It's not something that you pull out of the pack and squeeze in the air, because if you do, this is when you will get rid of the dose. So we want to make sure that we are not priming these devices. After we administer the Narcan, we want to call 911. So it doesn't matter if you administer naloxone first or you call 911 first. We just want to make sure that both are being done simultaneously. So when we call 911, they're going to have some questions. They need to know where you are at, what substances the individual is on, if you know, obviously, how much naloxone you have administered. Also, CPR might be required. So at this point, this is where we really want to make sure that we have 911 on the phone. If you are not CPR certified, they can walk you through the process of this. And if you are CPR certified, then you know how to proceed. We also have a chest compression only CPR now, so this is proven to be better than no CPR at all. So some people are not comfortable giving rescue breaths, and that is okay. And then we want to make sure that we're placing this individual in the overdose recovery position. So everything that is potentially on the top is going to be on the bottom. So their top elbow and their top knee are going to be on the floor of the side that they are laying on. And this position is going to keep the individual from being able to roll forward or backwards. So this way, if they are vomiting, they do not inhale their vomit. And this is really important. We want to make sure that we're waiting 2 to 3 minutes in between each dose. It can be helpful to set a timer on your phone or have a bystander set a timer. If we give these doses faster, this does not make them work. The medication has to get to the brain in order to work. After these 2 to 3 minutes, if the person is not breathing and EMS has not arrived yet, this is when we want to give another dose in the other nostril, but continuing to wait and giving another dose until EMS arrives or the person starts breathing again. But again, we want to make sure that we're waiting about 2 to 3 minutes in between each dose. Also, we want to stay with this individual and observe until EMS arrives. It's really important that we try to provide comfort to this individual. Some people may respond and have no memories of overdosing. We also want to try to help them remain calm. At this point, naloxone is going to trigger opioid withdrawals, so they are not going to feel so well. If this individual has any of these symptoms, this is what comes from experiencing withdrawals. So they can be erratic or have violent behavior. They can experience projectile vomiting. They can have musculoskeletal pain, and then also they can have a cardiovascular event. Typically, this is what we see if an individual has a long-term pre-existing medical condition or a stimulant can be involved. We really want to try to discourage individuals from using more substances for at least 2 hours. So continued use of these substances will not help with these withdrawals, and then also an individual can experience another overdose if they were to use more substances. So in closing, if you are an individual that does respond to an opioid overdose, I just want you to know how much of an important role that you may be able to play in someone else's life. We do not help dead people recover. So if you are able to save a life and able to help someone, that can potentially give them another chance to get to the resources that are needed in order for someone to find a new way to live. But it's most important to know that we absolutely need them alive beforehand.